Very good afternoon to Dr. Lee. Today I'm going to present the individual project 3 for the KMY 4033 Health Psychology Breast Cancer Prevention. My name is Chong Ting. Biometric numbers is 64220. The chapter 1's description of the health issue. Breast cancer is the most prevalent cancer associated with a high mortality occurrence rates among the women internationally. Every woman can limit her breast cancer risk factors, and women who are extremely vulnerable can have medical or surgical preventive measures. Prevention and management of this disorder is affected by preventive behavior, such as early diagnosis by screening tests. Epidemiological studies have also shown that the first prevention measure for the breast cancer includes smoking abstinence, balanced diet, increasing the physical activities, greater vegetable intake, decreased alcohol consumption. Target population for this project papers the women aged 18 to 49, especially those whose families' histories and background predispose them to a higher risk for breast cancer at young age. In both women with breast or ovarian cancer family history. Other than that, above health issue impacts women population psychosocially. Chapter 2: The Theory Informing Approach to Intervention. According to the Codex and Bocchis, risk factors for the breast cancer including the menarche age, late age of first pregnancies, late pregnancies, short to no breastfeeding cycles, and a subsequent menopause, the rise in obesity, smoking, inactivities, and hormonal replacement therapies. The chance of breast cancers are determined by a rise in the age and sex of women. The risk of breast cancer was consistently highest at late births, multi-parties, early menstruation, and late menopause. The use of exogenous hormone for oral contraceptives is one of the most widely researched variables in etiologies of breast cancer. History of breast cancers is also one of the factors. For Chapter 3, Description of the Intervention, Psychologicals. The first one is the cognitive behavioral therapies. This technique that aims at addressing the issue related to the dysfunctional thoughts, emotions, and behaviors by using a systematic methods geared toward the goals. CBT incorporates a range of methods and treatment systems, cognitive therapies as well as logical emotional therapies and multimodal therapies. Coping skills are learn such as advanced muscle relaxation, the meditation, hypnotherapies, the systematic desensitizations, the biofeedback change or improved behaviors and cognitive therapies. Psychotherapies or personal counseling with the psychotherapist assist the clients or patient with living problems. It includes non-directive psychodynamic assistential compassionate general or crisis intervention. Psychoeducational intervention who deal with psychological disturbance. Psychoeducation trainings include the patient education course in case of physical disease management. Family members are now part of the educations. Chapter 4: Expected Findings. Tens of 20 studies were statistically powered studies that assess the efficacy of this intervention. Most of the studies have demonstrated improved breathlessness, including the life qualities and symptoms, such as the pain, exhaustion, and stress. For patients undergo CBTs relative to control or normal treatment, studies examining the underlying intervention mechanism reported positive improvement in attitude, abilities, and self-efficacy of the patient. Many psychosocial treatment is focused on counseling, focusing on the psychosocial well-being, sense, and quality of life of the patient. The several educational activities were also carried out to improve the communication skills and understandings of patients, which were unidirectional in their deliveries. The multiple Psychosocial treatment targeted various problems in the course of the disease for advanced cancer patients. Interventions that were aimed at improving the decision-making and coordination between the patient and healthcare providers. The Chapter 5 Analysis of Social Identity to Health Issue and Intervention. Numerous reviews have shown how the breast cancers can affect women's body image and self-image, which can affect their sexual and marital experience. In addition, the treatments of the breast cancer involve the major physical, social, and psycho-emotional changes, with women's quality of life declining afterwards. This disease therefore can adversely affect the woman's performance of her social, mothers, and private positions in the communities. Women with breast cancers also have a sense of impairment because they are unable to perform everyday tasks such as household maintenance and parental care. Parents report that women have social roles which can alter following diagnosis of breast cancer. The change in practice has been observed at different levels and influence family, self-care, educational communities, and job activities. The role and social functioning of patients can decrease, particularly when they are treated for breast cancer. Chemotherapies, in particularly, can cause psychosocial and life quality problems. Short conclusions and reflection. Through this project paper, I realized that the risk of getting breast cancer can be increased by various factors. However, there are psychological interventions for women population to deal with it positively. Thank you.